Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors. Let's look at today's topic.
Continuing our series on breast care, today's topic is on breastfeeding, and I'm Dr. Sujatha Rajnikanth from Velvom. Breastfeeding is a huge ocean of a topic, and I'll be presenting it in as concise a form as possible. So quickly sharing my presentation. So we all know breastfeeding is important, and there's no confusions there. Why is breastfeeding important? There are loads of advantages for the mother as well as the baby. Coming to the baby, it boosts the baby's immune system. It protects the baby from tummy issues and bladder issues. Babies who are breastfed have less of respiratory issues, less of asthma, and they don't suffer from much fevers. Immunity is definitely high because all of the mother's antibodies goes to the baby before the baby starts developing antibodies of its own. And it helps in maintaining a healthy weight and also protects from ear infections. For the mother, breastfeeding is one excellent way of losing all the pregnancy weight that the mother gained over a period of 6 months to 1 year. So there is increase in fat loss, and the uterus, each time the baby suckles and the milk is let down, there is secretion of oxytocin, which helps in bringing the uterus back to its normal size quickly. And mommies who quit smoking during pregnancy tend to stay quit even during lactation for the sake of the baby. And definitely there's a lot of money saved. And more importantly, it also produces some amount of contraception. So as long as a woman is breastfeeding and she hasn't got her periods, there is a good amount of contraception and she will not get pregnant. So these are all the advantages for the mother. And well breastfed babies also tend to sleep well, hence mommies also sleep well. So for the feeding, important is the holding the position of the baby. The mother and the baby needs to be comfortable. There's always a learning curve. It takes a few days for both the mother as well as the baby to get comfortable with each other and for the baby to learn exactly how to hold the teeth, and the chin needs to press on the breast with the lips covering the areolae and suckling rather than biting only on the nipples. So common breastfeeding problems that mommies usually face are sore nipples, which occurs due to constant rubbing of the baby's tongue and lips on the nipple and the areolae. And with time, this slowly gets better. And there are ointments that can take care of it. Breast engorgement occurs, which can be taken care of by feeding the baby fully. Milk, there is usually something called a fore milk and a hind milk. The fore milk produced by the breasts are rich in water and the babies can easily suckle them, whereas the hind milk, which is rich in fat, the baby needs to put in more effort for it to take in the feed. Sometimes babies tend to take their mouth off after consuming the fore milk, and the mommies feel the baby is done with that breast and shift over. What happens because of this is the baby goes back to the breast repetitively. There is a fear that it's not getting enough milk. So make sure the baby gets both the fore milk and the hind milk. And after feeding, if the breast should feel completely soft, and it means the baby is completely had all the milk. In spite of this, if there is engorgement, you can always pump the milk out. Plugged milk ducts can simply be wiped clean, and that should help. And low milk supply is more of a controversial topic. What can be the causes of low milk supply? Stress is one of the main factors. The more the mother worries that, oh my God, I might not be producing enough milk, the stress hormones reduce the milk producing hormones and hence can result in less production of milk. So the mother needs to eat well and drink well, thereby taking good care of her health. Some medications rarely suppress milk supply. Smoking and too much of caffeine can also contribute to decrease in breast milk supply. So eat well and drink lots. Those are two things all breastfeeding mommies need to know. So what are not signs of low milk supply? If the baby is fussy after feeds, or if it's feeding repetitively in clusters, or if the breasts feel too soft, like somebody has engorged heavy breasts and it's always leaking, and in the other lady's case it's not happening, doesn't mean that she is producing less of milk. If somebody tells you, definitely, especially not somebody informing you that whenever the baby is crying or fussy, milk, there's not enough milk, the baby might be hungry, is definitely not a reason. or a sign of low milk supply. If the baby takes a bottle after a feed, again, it doesn't mean the milk supply is less, because suckling is one of baby's most primal reflex. Anytime you put a finger or a teat or a nipple or your breast to the baby's mouth, it starts suckling. So after a good feed, if you had to put a bottle, it is going to suckle because it is its natural instinct. That doesn't mean the baby is hungry. It just means it is following its instinct. And if there is no overflowing or happening and you don't have a need to pump, it definitely does not mean that you're not producing enough milk. Signs of good milk supply are the baby is producing enough urine, it is happy, it is active, and it is growing in weight. You can actually feel the baby's growing in weight in your arms, and those are signs that you are producing enough milk. But why would the baby want to suckle frequently, or why would the baby cry frequently? These are the reasons you need to remember why a baby might want to constantly keep suckling at the breast or constantly crying, or it wants to hold you. So the baby comes from a very dark, warm, cozy environment, and it's out in a bright environment with lots of noises and different sounds. So it needs to get used to all that stimulus. So it wants to be held. It feels it's too bright or dark. It could be hungry, happy, sad, tired, silly, worried, confused, hurt, hot, cold. It feels gassy. It is upset. It is hungry. It just likes our smell. It likes our warmth. It wants to be held. These are all the reasons a baby might want to repetitively suckle, or these are also the reasons why a baby can cry. So a crying baby or a repetitively suckling baby does not mean a hungry baby. So breastfeeding is a beautiful relationship between a mother and a baby, and a relaxed mother is more important, and a relaxed positive attitude is more important for successful breastfeeding. So what hospitals usually do is they usually have a written policy, and mothers during pregnancy are counseled accordingly about breastfeeding and how to initiate it and what are the problems that can be faced and how to handle them. And immediately after birth, the baby is immediately put on the mother's chest and allowed to suckle, and skin to skin contact is encouraged. Keeping the baby in the same room or as close to the mother as possible encourages feeding. If at all the baby needs supplements, it is advised in the right way, and if it is available, breast milk is provided from other sources. And even after discharge, after going into the community, there needs to be enough support from the family and everybody to continue breastfeeding. So this is in short about breastfeeding. So any further doubts, please feel free to get in touch with me. I thank Hiranya Medical Service for giving me this opportunity to speak about breast and the various breast-related issues. Thank you.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.